Hello, I'm Dr. David Green, CEO of Preferred Pain Center here in beautiful Phoenix, Arizona. Today I'm at the Scottsdale waterfront, which is one of the most attractive areas over the last 5 years as they've sort of built it up and connected the Scottsdale Fashion Square mall area with the Old Town area with this pedestrian bridge. They've built up a lot of lofts, condos, trendy nightclubs and restaurants in the area. At night it is gorgeous. They often have functions, charity functions, and events up and down the waterfront as well. There are over 125 professional art studios and galleries in this area of Scottsdale, which is more than anywhere in the country. In Scottsdale itself, there are more five-star resorts than anywhere except New York City. You have the Phoenician, you have the Fairmont, the Four Seasons, and then a couple others as well. There's about 220,000 people that live in Scottsdale right now, and in the 90s it was listed as one of the, quote, most livable cities in the United States. Some people in Arizona and in Scottsdale laugh at that, because if it was one of the most livable cities, why is it also one of the most expensive cities? So, at any rate, the topic for today is something that I've discussed before, but I wanted to touch on it. And the title that I would give this is, if I have sciatica, is that a death sentence? And the answer is obviously no. But if you're experiencing sciatica and it's a rip-roaring pain, you might feel like it's a death sentence. The reason is that the pain just doesn't go away. It just stays there like a pebble in your shoe. You know, it just won't leave. And it can be incapacitating, basically. It can make you have to stay in bed. Any sort of upright activity can put tension on the nerve root that's being compressed, and it can cause that pain that just is fiery, and it shoots down your leg depending on where the disc herniation is. So why do you get sciatica? Well, the term sciatica refers to inflammation around the sciatic nerve, which is actually a combination of multiple nerve roots in the lower lumbar spine. You have one sciatic nerve that comes out on the right, you have one sciatic nerve that comes out on the left. So by and large, the most common reason that people get sciatica is if they have a slipped disc, otherwise known as a herniated disc, otherwise known as a lumbar intervertebral herniated disc. You know, you can get a piece of disc squeezing out. A lot of times it's from degenerative disc disease or just normal wear and tear. 1% of the population at any one point in time has one. So it's very common. I mean, there's 300 and some million people in this country. That means over 3 million of us at any one point in time have sciatica. So when the disc pops out or squeezes out, let's say it's jelly out of a jelly donut, let's use that analogy, and the jelly pushes on a nerve root, it sparks up inflammation around that nerve root. And that is what causes the pain to shoot down. So if it's the L4, the lumbar 4 nerve root, pain usually comes down the side of the thigh onto the front of the calf and the front of the foot. L5 would be out here. S1 can often be on the side or the bottom of the foot. May or may not cause the inability to lift up the foot or evert the foot. You know, that puts it into a different category. That is someone who probably will need surgery. Probably, you know, the longer you wait, the more the chances of it not getting better, okay? But if we're just talking about pain, then it really is a quality of life decision. So you can give it 4 to 12 weeks and see how, conservative treatment is going to work. So you have sciatica, what do you do next? Well, it's not a death sentence. You can either, 1, wait it out if it's not too bad with the pain. 2, you can go see, you know, we have at Preferred Pain Center, for instance, we have a chiropractic doctor, a rehab doctor, a board-certified, fellowship-trained pain doctor. We have multiple options for patients and multiple treatments. It may be that medication acutely, like narcotics, or maybe what's called a Medrol dose pack, which is a 3-day burst of prednisone, some anti-inflammatories, some Tylenol. Those things may be able to simmer it down so that then the patient can benefit from chiropractic treatment, you know, physical therapy types of treatments, maybe spinal decompression therapy. We have one of those machines at Preferred Pain Center. If those are working, but not more than, say, like 50% of the pain, then an epidural steroid injection may be in the patient's best interest. and we have a doctor who does those as well. The objective is to try and mitigate the pain downward, to try and avoid the need for surgery. Because with sciatica, if you can avoid surgery, the outcome with surgery versus avoiding surgery at 1 year, the same. So if you can avoid it, you can then avoid the risks of surgery, the risks of the resultant scar tissue and whatnot, and the potential for degeneration by taking some of the disc out. Those types of things, you can avoid those risks. So that's an overview of sciatica. Over 90% of patients who have sciatica do not end up needing surgery. There are some legitimate indications for surgery, which I'm not going to touch on in this video, but needless to say, over 90% can avoid it, and Preferred Pain Center offers all of the non-operative types of treatments that can benefit you. Check us out on the internet at www.preferredpaincenter.com. You can put a /blog on the end to check out our blog of pain. There's a lot of educational animations and videos on the website, as well as testimonials. Give us a call as well at 602-507-6550. I'm Dr. David Green, CEO of Preferred Pain Center. Your pain stops here.